بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. محاضرتنا النهاردة عن Series and Model of Health Education. في نهاية المحاضرة لازم نكون عارفين ايه هو الديفينيشن بتاعة Health Education الموديل، define models and series, characteristic of theory and model, identify component of model and series, mention importance of model and series in health education, uses of theory and model, enumerate factors affecting individual and community behavior change, comparison between theory and model, individual models, community models. Introduction. Developing health promotion programs that support healthy lifestyle behaviors require comprehensive planning. Program planners can use models and series to guide this process as they work with individuals, groups, and communities. Individuals and communities have multiple risky lifestyle behavior, including physical inactivity, unhealthy diet, smoking, and stress. Definition of health education models is conceptual models organize global ideas and simplify complete system of thoughts into succinct formats. Thus, conceptual models provide meaningful description to guide the thinking, observation, and the practice of educator. Definition: theory as an idea or set of ideas that is intended to explain facts or events. The general principles or ideas that relate to a particular subject. Models referred to as schematic description of system theory or phenomena that account for its known or inferred properties and may be used for further study of its characteristics. Characteristic of theory and model. Logic. Consistent with everyday observation, similar to those used in previous successful programs, supported by past research in the same area or related ideas. Explanatory function. Account for or explain a phenomena, usually stated in proposition and concepts. Good hypotheses provide rigorous test of theory. Component of model or theory. Theories and models both include concepts, constructs. Concepts are the primary components of model or theory. Constructs are the components that have been created for use in specific model or theory. Importance of model and series. Help to explain why individuals and communities behave the way they do. Increase the effectiveness of health promotion program design, implementation, evaluation. Support lifestyle behavior changes of individuals, groups, and communities. Uses of theory and models as toolbox for moving beyond institution to designing and evaluating health education intervention that are based on an understanding of why people engage in certain health behavior. As a foundation for program planning and development, as roadmap for studying problems, developing appropriate intervention, identifying indicators, and evaluating impacts, as a guide to help explain the processes for changing behavior and influences of many forces that affect it, include social and physical environments, as compasses to help planners to identify the most suitable target audience methods for fostering change and outcome for evaluating. Comparison between model and theory. Model: simplified, miniaturized application of concepts for addressing problems. Theory: explain or predict phenomena. Model: macro-level guidance. Theory: micro-level guidance. Model: not enough empirically tested. Theory: empirically tested. Model: creative. Theory: based in previous literature. Model usually tries to cover a lot. Theory usually parsimonious. Model may embody one or more theories. Theory doesn't contain any model. Model example: health belief model. Theory example: social cognitive theory. Factors affecting an individual's or community change behaviors, including low income, lack of access to safe places to exercise, inaccessibility of healthy food, cultural and ethnic differences. Individual models: health belief model, health promotion model, activated health education model, trans-theoretical model or stages of change model, the extended barrel process model. Individual models: health belief model, based on individuals' beliefs and attitude in changing behavior. For a changing to take place, the individual must first believe that change is both possible and beneficial. Developed to understanding why some people take specific action to avoid illness, whereas the others fail to protect themselves. For example, if a person doesn't consider their diet to be unhealthy, they are unlikely to make any significant change to it. One criticism of the health belief model is that it tends to treat behavior change as discrete event, rather than process or sequence of events. Other theories, such as the stages of change model, consider change as more dynamic process. The three major components of the health belief model: 1. Individual perception. Person's belief about his or her own susceptibility to disease, plus the seriousness with which she views the disease, equals the perceived threat of an illness for each person. 2. Modifying factors. Demographic variables, age, gender, socio-psychological variables, personality, social class, structural variables, knowledge about the disease. 3. Variables affecting the likelihood of initiating action. Person's perceived benefits of action minus his or her perceived barriers to accomplishing action, equals the likelihood that the person will take action to change his or her behaviors. 4 types of belief in individual models. 1. Perceived susceptibility to disease. 2. Perceived severity or consequences of the problem. 3. Perceived benefits, a specified action, treatment, or prevention activities. 4. Perceived barriers to taking action and any barriers that would interfere with this action. Another concept: cues to action. These are events, internal or external, which can activate person's readiness to act or change and stimulate an observable behavior. Self-efficacy is simply person's confidence in his ability to successfully perform an action. Comparison concept: perceived susceptibility. Definition: belief about chance of getting condition. Examples: individual perception of personal susceptibility to specific illness or accident may significantly affect their willingness to take preventive action. Potential change strategies define what populations are at risk and their level of risk based on an individual characteristics or behavior. Help the individual develop an accurate perception of his or her own risk. 2. Perceived severity. Definition: beliefs about seriousness of condition and its consequences. Examples: people may not respond to suggestions that they obtain flu shot because they don't view influenza as a serious disease. Potential change strategy specifies the consequences of a condition and recommended action. 3. Concept: perceived barriers. Definition: beliefs about the material and psychological costs of the taking action. Examples: if the change is perceived as a difficult, unpleasant or inconvenient and outweighs the perceived benefits, it's less likely to occur. Potential change strategies offer reassurance, incentiveness, and assistance to correct its information. 4. Concept. Use to action. Definition. Factors that activate readiness to change a trigger mechanism. Examples. A reminder note from dentist that is the time for checkup may be sufficient to promote action. Potential change strategies provide how-to information, promote awareness, and employ reminder system. 5. Concept. Self-efficacy. Definition. Confidence in one's ability to take action. Examples. One's opinions of what one is capable of doing is based largely on experience with similar action or circumstances encountered or observed in the past. Potential change strategies provide training and guidance in performing action, use progressive goal setting, give verbal reinforcement, demonstrate desired behavior. To model in individual models. Health promotion model, developed as complement to other health protecting models, as the health belief models explain that health lifestyle patterns or health promoting behavior will occur. 3 categories of determinant of health promoting behavior: cognitive perceptual factors, modifying factors, variables affecting the likelihood of initiating action. Cognitive perceptual factors: perceived health status, perceived control of health, perceived health efficacy, perceived benefits of health promoting behavior. Modifying factors: demographic factors, age, gender, race, ethnicity, education, income. Biological characteristics, body weight, height. Interpersonal influences, expectation of significant others, family patterns of health care, interaction with health professionals, set national environmental factors, access to care, behavioral factors, cognitive and psychomotor skills necessary to carry out health behavior. Variables affecting the likelihood of initiating action. Variables affecting the likelihood of action depend on internal and external cues. The desire to feel well, individualized health teaching, mass media health promotion campaigns. 3. Model. An individual model, activated health education model. This model has as its focus active participation in the assessment of one's health, awareness of health values, and individual responsibility for health behavior, developed through a review of health education literature and was based on component of successful intervention. The 3 fundamental premises of the model are: 1. Active involvement. Actively engage individuals in the assessment of their health through activities such as field study, laboratory testing, screening, and surveys of the target behavior. Individuals become aware of their actual health behavior. This phase establishes baseline measures and identifies observable behavior for future. 2. Awareness. Presents information that provides rationale for including the previously completed experiential activity and creates awareness of target behavior. This phase focuses on increasing feelings of accessibility and creating tension between actual and ideal behavior. 3. Responsibility. Involves participants in the change process, facilitates their identification and clarification of personal health values, and develop a customized plan for behavior change. Self-management strategies are introduced and participants develop their own plans of action such as self-monitoring, setting measurable goals, stimulus control, use of social support systems, and visual imagery and goal achievement. Stages of change model or trans-theoretical model. Methods used for a desired outcome are not generic because individuals are not always at the same stage or level of readiness. The model also assumes people may relapse or return to the previous stage. Return to the original stage can occur and often does. The model identifies 6 stages. Pre-contemplation, not interested in changing behavior, individual is either not considering change or consciously intend to maintain behavior. What problem? Contemplation, individual is considering making a change, but is yet to take any action. Maybe I do have a problem. Preparation, planning for an experimenting with behavior change but lacking self-efficacy to actively engage in the process. Individual has made a definite decision to change and is making any necessary preparation. Action. Actively engaging in the behavior change process. I am making a change now. Maintenance. The person continues with desirable action. Individual maintenance the behavior from this stage. An individual can either consolidate the change or relapse. I have reached my goal. Now I just have to keep it going. Termination. The person has zero temptation and ability to resist relapse. Comparison. Pre-contemplation. Definition. Has no intention of taking action within the next 6 months. Examples. It isn't that I can't see the solution. I just can't see the problem. Potential change strategies. Increase awareness of need for change. Personalize information about risks and benefits. Stage 2. Contemplation. Definition. Intended to take action in the next 6 months. Examples. I want to stop feeling so stuck. Potential change strategies. Motivated encourage making a specific plan. Stage 3. Preparation. Definition. Intended to take action within the next 30 days and has taken some behavioral steps in this direction. Examples. I just took out of membership to a fitness facility. Potential change strategies assist with developing and implementing concrete action plan, help set gradual goals. Stage 4. Action. Definition has changed behavior for less than 6 months. Examples. I have started exercising and while I enjoy it, sometimes I find it as chore. Potential change strategies assist with feedback, problem solving, social support, and reinforcement. 5 stage. Maintenance. Definition. Has changed behavior for more than 6 months. Examples. Exercising 3 times a week has become a part of my lifestyle. Potential change strategies assist with coping, reminders, finding alternatives, avoiding slips, relapses as applicable. 5 model and the individual model. The extended parallel process model. This model proposes that people who, when presented with a risk message, engage into a appraisal process. Determination of whether they are susceptible to identified threat and whether the threat is severe, whether the recommended action can reduce that threat, i.e., response efficacy, and whether they can successfully perform the recommended action, i.e., self-efficacy. If the threat is perceived as trivial or irrelevant, they generally ignore the risk message and urging to take the recommended action. If people believe they are susceptible to severe threat and their level of fear is aroused, they are motivated to assess whether the recommended action can reduce that threat, i.e., response efficacy, and whether they can perform the recommended action, i.e. self-efficacy. Concept 3, danger, harm. Subconcept, susceptibility, likelihood. Example, I am at risk for HIV infection. Potential strategies emphasize the severity of threat and audience or clients' stability to the threat. Threat, danger, harm, subsequent severity, magnitude, or seriousness. Example, is the HIV infection a serious health threat? Methods should emphasize or illustrate how health threat occurs to people who are demographically similar to audience. Concept efficacy, effectiveness. Subconcept, response efficacy, perceived effectiveness in averting threat. Example, will condoms work in preventing HIV infection? Potential strategies, emphasis that recommended response works and is effective in averting threat or decreasing one's chance of experiencing health threat. Efficacy, effectiveness. Subconcept, self-efficacy, perceived ability to perform recommended behavior. Example, can we use condoms? Potential strategies, performance accomplishment, role-playing, participant modeling, vicarious experience, watching lives or sampling model. Community models. Proceed model, ecological models, social marketing model. Proceed model focus primarily on planning and evaluating community health education program. Proceed is an acronym for predisposing, reinforcing and enabling causes in educational, diagnosis and evaluation. One strength of the proceed model is that it consistently involves the client in the problem-solving approach to provide health education for an identified area of need. Focus on helping communities change their behavior. Associated with the proceed model as the community health educator proceeds to plan, implement, and evaluate health education programs. The 9 phases of the proceed model. Title: Social diagnosis, description, social concern with community are identified. Epidemiological diagnosis. Epidemiological data are used to suggest health problems. Behavioral and environmental diagnosis. Behavioral and environmental risk factors that seem to affect health are identified. Educational and organizational diagnosis. Predisposing, reinforcing, and enabling factors are identified. Impact evaluation. The immediate effects or objectives of educational program are evaluated. Outcome evaluation. The short-term and long-term effects of the educational program are evaluated. Ecological models. Focus attention on the individual and the social environmental factors as the targets for any interventions. Some health education professionals maintain that using such terms as lifestyle and health behavior may direct attention toward changing individuals rather than changing the social and physical environment. Suggests reciprocal causation between the individual and the environment. Human behavior that is viewed as being determined by the following concept: intrapersonal capacity. Definition: individual characteristics that influence behavior such as knowledge, attitudes, beliefs, and personality traits. Interpersonal supports. Interpersonal relationship processes and primary groups, including family, friends, and peers, that provide social identity, support, and role definition. Environmental context. Institutional organizational factors, rules, regulation, policies, and informal structures which may constrain or promote recommended behavior. Community factors, social networks and norms or standards which exist formally or informally among individuals, groups, and organizations. Public policy, local, state, and federal policies and laws that regulate or support healthy actions and practices for disease prevention, early detection, control, and management. An ecological model should focus attention on environmental causes of behavior rather than be individually focused, and should also identify environmental intervention for enhancing health. Social marketing model. Social marketing is defined as the design, implementation, and control of programs seeking to increase accessibility of social idea or practice in target group. The principles and technique of marketing are used to increase the effectiveness of programs designed to produce a social change. It uses concepts of market segmentation, consumer behavior research, concept development, communication, facilitation, incentives, and exchange theory to maximizing target audience responses. This process can be used to promote healthy lifestyles or teach specific change in health behavior. It is a viable tool in health promotion campaigns such as National Diabetes Education Program. When properly designed, these campaigns can influence knowledge, attitude, and behaviors. Knowledge change is easily achieved through social marketing. Social marketing is also effective in producing an action change such as getting the flu shot. But social marketing is less effective in behavioral change such as modification in food, smoking, exercise, or drinking habits or value change. Three objectives of social marketing: disseminate new data and information on practices to individuals, offset the negative effect of practice or promotional effort by another organization or group, motivate people to move from intention to action. The marketing process for PS. Product. In health education, the product is a specific health message promoting knowledge awareness of a specific behavior. Promotion. The promotion component addresses how to make program visible and attractive. Place. This relates to the distribution of products through channels, sites where the target audience frequents to reach the target audience. Price. Relate to the cost of participation in the program. Media is a major tool in social marketing and includes television, radio, newspaper, newsletters, brochure, posters. Other promotional tools may include health screening at sites convenient to the target audience such as flu shot at pharmacy, birth and exhibits, health poster contests for children through their schools, health fairs targeting a segment of population. The social marketing process consists of 7 steps: planning, identification of target audience including segmentation of target audience, marketing, mix objectives and resources, selecting channels and materials, developing the program, pre-testing effectiveness, formative and process evaluation, what worked and what didn't and why, implementation, conduct activities, refinement of the program based on the evaluation result, monitoring and evaluation. Thank you.